What up, everybody? See this? Jesse's got his bike back on the road. Problem was, he needed a new rear tire and went through a few trials and tribulations trying to get a new one on, but now it's on. So look at that. Look at how sexy he is riding along there with his new tire. Damn. Okay, so while I'm on this little ride here with Jesse, I thought I'd make a little continuation of my story of my health problems. So for a quick recap, I was diagnosed with psoriatic arthritis, yada yada yada. Started taking medication to try to deal with that. And in the meantime, somewhere in the mix of it all, my jaw got all screwed up and was causing me much grief and pain and discomfort. So the next portion of the story just involves the biggest part of the struggle, I would say, of dealing with it all. I really felt like I was getting nowhere for a while. So let's talk about the medication. So as I said in a previous video, I started taking methotrexate, which is it's actually like a form of chemotherapy drug if used in higher doses. So this stuff is actually poisonous. Fortunately for me, I only had to take it was 10 pills once a week, and that day it was kind of a terrible day. Like I had basic gut rot for all of the day that I took that. And then for the rest of the week I had to take a folic acid supplement because methotrexate is a anti-folate, if that makes any sense. So anyways, that was supposed to be the best course for me, and I was on that for about 3 or 4 months, I think. But it didn't do anything for me. It didn't help me one bit. My feet and joints and everything hurt like crazy. Nothing helped. Okay? So went on to another medication called sulfasalazine. Once again, didn't work. Moving on to more meds here. The next one I tried was called leflunomide. This is after 6 months of meds not working. Leflunomide, I don't really know a whole lot about it. All I know is that it's probably just about as toxic as methotrexate. Like, those drugs are really hard on your liver. So, yeah, the leflunomide, I was on that for another 3 or 4 months, and that didn't do anything for me either. So pretty much the course of a whole year, I'm going through this list of medications that somehow deep down in my gut, I just knew that they weren't going to work for me. You know, they had more side effects than positive effects. So, like, the methotrexate just made me feel kind of sick, and it took away from my kind of energy levels, I guess. It just made me feel sort of depressed, I think. The sulfasalazine, really, all that it did was it turned my pee really, really yellow, like almost orange yellow. Yeah. And then the leflunomide, it kind of gave me the worst effect of it all. Like, I couldn't sleep very well with the leflunomide. I just had terrible sleeps, and I had like a sore throat the whole time that I was on it. So that was kind of weird. So that's the arthritis side of this story. Now, when it comes to my jaw, I was doing all kinds of shit to try to get it feeling better. Okay, where do I start with this one? So I went and I saw a chiropractor, and he did a bunch of like active release of the muscles on around my face, which it helped unlock my jaw, because when this dislocation or whatever it was first happened, like my jaw was actually locked on one side. It wouldn't open on one side, but it would open on the other side. So it was kind of strange to open my mouth and talk and chew and everything like that. Jeez, Jesse's fast. Look at him. So anyway, the chiropractor was able to unlock my jaw, but things were still quite like screwed up in there. So I saw a naturopath, and I tried prolotherapy, which is basically like injections into the joint to try to stimulate healing. I think that helps stabilize the jaw a bit more, because it would like basically come like dislocated, like very dislocated, while I was doing simple tasks like brushing my teeth. Not very comfortable, very startling. And yeah, so those guys helped, but I was still not doing very well. Like I wasn't even halfway there yet. I mean, I just had like minor bits of help for something that was ultimately very bad. So what I ended up doing, and I had high hopes for this, was I ended up seeing a TMJ specialist who basically fitted me up with a sort of a mouth guard. It's like a splint for TMJ, and basically it's a sort of like a plastic kind of retainer thing that sits on your lower teeth, and the idea was it would be adjusted so that your teeth would bite evenly on it, and then it would relieve any uneven pressure that would result from clenching on uneven teeth. So my right side, my teeth were touching together before, or they were touching together first, like without my left side teeth touching together. And I think it's because like my jaw was actually starting to wear down on the one side. And yeah, so my bite was all screwed up. So this TMJ splint would it would be adjusted to accommodate for that. And I would go back every like couple weeks to get it readjusted. So every time I went back, this splint would get ground down on the right side because my bite was getting further and further away from centered. I was wondering like what the hell, like why is this doing this, right? And so I'm not sure if the splint actually aided in that or what, but yeah, my bite ended up getting really, really skewed, and it still is. So I was on that for quite a while, and you know what? Ultimately, it didn't do anything. Just like my arthritis meds, didn't do fuck all. How pissed was I? Lots, because I was told that it was going to work, you know? I was told that I didn't have anything to worry about, and my hopes were raised to a very high level, and I spent a lot of time and money actually going and getting this treatment, and so I didn't feel very good about it, that it wasn't working. So yeah, for the period of about a year, lots of just getting nowhere. And that's probably the most difficult part of the story. I promise you, though, in my next vlog about this, I will have some better news. It does start getting better, so stay tuned for that. Hey. Hey, Jesse. Hey.